This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to another edition of Mon Health Live. We are trying to get the word out, get the community educated about what they need to know about this current pandemic we're going through, COVID-19. So we'll cover a lot of areas. We'll cover the most recent numbers. We'll talk about the vaccine, and that's what we're here to do, present information for you on this Saturday morning. Welcome back. David Goldberg is taking the day off, but Dr. Crystal Atkinson, Chief Nursing Executive of the Mon Health System, is with us. Dr. Atkinson, good morning. Thanks for coming on.
Good morning, Kyle. Good to talk with you this morning.
And we also have Dr. Archana Vasudevan, infectious disease expert at Mon Health. And Dr. V, good morning.
Good morning, Kyle. How are you today?
Doing very well. Thanks for coming on, both of you. Dr. Atkinson, let's start with you. Give us the updates. Give us the latest numbers and what's new, what people need to know since we talked last week about what's been going on.
Absolutely, Kyle. So we continue to see increased numbers of patients coming into the hospital, not only at the medical center here or through the Mon Health System, but throughout the state. So again, we are making sure that we're trying to we thank you for this partnership and getting the word out, but continuing to make sure that we take the precautions that we need to take. So we're wearing our mask. We're making sure that we're socially distanced. And where we are now, we're in the process with our teams of getting our teams vaccinated. I'm sure everybody has heard about the different vaccines that we have out there. We're encouraging people that as the time is appropriate to make sure that they discuss with their primary care physicians and get themselves vaccinated.
So the vaccine is out there. It's working its way through the community. It started with healthcare providers. It started with the elderly population. Teachers, I believe, are next on the line. How, again, get us caught up with where we at with the vaccine rollout at this moment.
Right, so throughout our system, we've vaccinated over 1,200 of our employees. We still are following what the CDC is recommending, the 1A, 1B, et cetera. So again, the people that are on the front lines that are taking care of not only our COVID patients, but our patients that are coming in, whether it's ED, whether it's surgery, et cetera, or on our medical surgical units. So we're still following that guidance right now. But I think that as we still we hear more information about the timing of when the general public can be vaccinated, we want to make sure that we're following those guidelines on where the distribution is going to happen, the vaccinations are going to happen. David has been working with leaders across the state on the timing of that so that we all can work and we can partner with the health department to make sure that we have a process in place to be able to have an orderly process and arrangement for people to become vaccinated.
Mm-hmm. The plan is in place. That's the most important thing. The plan is in place. It's just a matter of, at this point, getting the needed doses.
Absolutely, yes.
Okay. Very good. One more thing, Dr. Atkinson, and I know people may be concerned. The hospital is extremely safe. I was in there, as a matter of fact. I had an appointment on Wednesday, and it is extremely safe. The people come in, you come in one by one, you're socially distanced, they check your temperature, everyone is masked, you go to the area where you have your appointment, it's socially distanced there. So I can say, by my example, having been in the hospital on Wednesday, every caution is being taken, and it's a very, very safe place.
It's absolutely safe, and I will tell you, we have some of the best in the business as far as our environmental services teams. They are consistently going through our public areas, where our patient-facing, where our patients are, where our staff are working to make sure that surfaces are wiped down. So, again, as we have said for weeks now, please do not put off coming to the to the facility, whether it's to your PCP or to the emergency room if you need help. Our hospital is very safe.
Okay. All right, Dr. V, again, thanks for coming on this morning. We appreciate your time. One of the topics that's been going around the last couple of weeks is the new strain of this virus, which I think many believe originated in the United Kingdom, but it's here. I say here, it's in the United States. So what can you tell us about that, and what's the latest?
Yeah, so viruses, they change constantly. They change constantly through a process called mutation. And the current mutations that we are noticing in the UK strain seem to have made it more transmissible. That basically means that we are seeing more people get infected quicker. The virus seems to spread more easily between people. Now, there are other variants as well. Like you mentioned, the one in UK has been getting all the press. They have also noticed new variants coming from South Africa, Nigeria, and Japan. In the United States, they've already detected this new strain from UK in more than 9 states. There have been more than 60 cases. The important thing to keep in mind is, as far as people are concerned, nothing has changed. Wear your mask, wash your hands, follow the same precautions. The virus is still the same, as in the severity of the virus. There is no new information that it causes any more severe disease or if there are any more deaths or mortality associated with the new strain. So as far as the general public is concerned, continue to practice the same that you've been doing in the last 1 year. Wash your hands, wear a mask, protect yourself, avoid crowds, practice social distancing, and the CDC is continuing to do surveillance across the United States. They are checking for the strain, and the more information we have, the information will be released to the public.
Okay, as you mentioned, it's in at least 9 states, maybe more. I believe it's been detected in a couple of neighboring states, Pennsylvania and Maryland, but has it been detected in West Virginia yet?
Not as of yet.
Okay.
Not as of yet. The one concern that people are having with this virus in mind, with this new strain in mind, is the effectiveness of the vaccines. As of now, there is no evidence that the effectiveness of the vaccine could change. Most experts believe that that will not happen because the immune response to the virus will not change because it is targeting the protein that helps the virus bind to the human cell. And it affects the immunity in different levels, in different sites as well. So that fundamentally should not change based on just a few mutations.
All right, Dr. V, let's continue the talk about the vaccine. The 2 vaccines that have been prominent, Moderna and Pfizer, I believe all the people in this area, in this state, that have been vaccinated by one of those 2. There's a third one, I believe, that is very close to becoming available. What would you tell people who are leery about getting any of these vaccines?
So it is a good question. I'm glad you asked me that. By receiving these vaccines, we are not just protecting ourselves, we are also protecting others in our community. And I want to bring up the concept of herd immunity. So basically what it means is when enough people in a population have protection against an infection, the bacteria or the virus cannot spread and cause the disease. So that way, with COVID-19, if majority of the people in a population are protected against it, it is less likely to circulate and infect people who cannot protect themselves. So it's really important, not just for ourselves, but for others in the community as well, to decrease the transmission of this virus by getting the vaccination. It is hard to say which of us is going to have a more severe outcome with the virus and which of us will have a milder to moderate disease and recover from it completely. Both the vaccines, the Pfizer and the Moderna ones, have so far shown excellent efficacy and very low adverse effects. So I would recommend anyone who once gets approved approved to receive the vaccination should get it, both for themselves and for those around them.
And I'm assuming both you, Dr. V, and Dr. Atkinson, you've both been vaccinated once, if not twice. So if you want to talk about what your experience has been like with getting the vaccinations.
Yeah,
I have. Go ahead,
Go ahead, Dr. V.
Dr. V, go ahead.
Okay. So I have received both my shots. Luckily, I have not had any reactions from the vaccine, both the first one and the second one. If anything, I had a little more muscle soreness with my flu shot, but both of the COVID vaccines, I did great.
Dr. Atkinson?
Yeah, my experience has been the same. Nothing that was much different than what Dr. V described, just a little soreness in my arm. But other than that, nothing else.
All right, very good. So as simple as that, get the vaccine. It's safe and it's very effective. We're talking about the pandemic, COVID, all things COVID, and the vaccine, and specifically the strain that's been detected that's come from the UK. We'll continue the conversation. This is Mon Health Live. We're back after this on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
This is Mon Health Live as we're getting the information out, things that you need to know concerning this pandemic and COVID-19. Our guests this morning, Dr. Crystal Atkinson, Chief Nursing Executive of the Mon Health Systems, and also infectious disease expert at Mon Health, Dr. Archana Vasudevan. And again, ladies, thanks for coming on this Saturday morning. We appreciate the time. Let's talk a little bit about, and again, this is information that's been out there, but if someone just recently thinks they've been exposed to someone who has COVID-19, if they think they might have it, Dr. Atkinson, what should they do?
Definitely they need to reach out to their primary care physician and let them know the symptoms that they're experiencing. From there, they'll have a screening process done, and then that provider will make the decision whether or not they need to be tested. We have not seen when people have the exposure, the process that we've been taking here is that we have been asking people to quarantine after they've been tested. Once they receive their test results and they have the confirmation of that, then we ask them to continue that quarantine. And if they have other people in their homes, we ask them to continue to quarantine away from others and to make sure that they are not leaving their home. Again, that's how we can continue to contain the spread.
Dr. V, let's talk about the different antibodies that may aid the immune system in someone that's fighting this.
Right. So one is natural immunity that your body makes in the antibodies it produces. So much like that, there are newer antibodies that are synthesized in a lab, and they act like the antibodies that your body makes and help limit the amount of virus in your body. These synthesized antibodies, they are called monoclonal antibodies, and recently FDA has issued emergency use authorization for two of these medications, and we have been giving those to our patients who have mild to moderate COVID-19 disease. So basically, these are patients who have positive COVID. They have a test, and they present to us within 10 days of their symptoms. Mm-hmm. The FDA approval was given for patients who present within 10 days. So that's really important that you talk to your providers if you have mild COVID and ask about this treatment option. And if you have other problems like diabetes, kidney disease, or any other immunosuppressive disease, if you're older than 65 years of age, or if you have a body mass index of more than 35, or even if you're younger than 55 years of age, but you have other health problems, have high blood pressure, COPD, talk to your provider, reach out to us, and we've been doing this in Mon Health as well. Basically, it's an IV medication, one dose that we give, and then we monitor the patients receiving the medication for about an hour after they've received this medication to make sure they're doing well. It acts by binding to the sites where the virus can bind and affect and infect the person. It's been tolerated really well. There's been studies published that this medication has the potency to reduce hospitalizations, has the possibility of preventing more severe COVID disease, and I think our community should know more about this medication. We have access to it, so talk to your providers about that.
Okay, so the monoclonal antibody treatment is available at Mon Health. It's something that you've been working and you've been seeing very good results from, right?
That is correct.
Okay.
Yes. Especially our elderly population who have just started having symptoms. They have mild symptoms. I think these patients are excellent candidates for these medications because both the monoclonal antibodies that have been approved, they have shown to decrease the risk for severe COVID and subsequent hospitalization.
Mm-hmm. Have you seen with this type of treatment, do you see the effects of COVID-19? It lessens the effects. Is that correct?
That is correct. So you must understand, Kyle, that with the majority of this infection, most people have mild to moderate symptoms and they recover on their own. There is a small population that goes on to have more severe disease, and in this particular population, the rate for complications and death is very high. And it is hard to predict which of our patients will go on to have just mild disease versus who will have more severe disease. And there are some risk factors that are associated with poorer outcomes. So we try to offer these medications to all patients who have these risk factors. So that way we can prevent a more severe outcome or hospitalization in these patients.
Mm-hmm. Dr. Atkinson, as Dr. V said there, a lot of people, they experience minor symptoms. Some people are completely asymptomatic. When is the threshold in your mind, if you're feeling these symptoms, when should you seek care? When should you head for the hospital?
Yeah, I think when we're looking at, from a hospital standpoint, an emergency situation is when people are starting to develop chest pain, shortness of breath, they're having severe respiratory issues, breathing, etc. They really need to come to the hospital first. I think when we're having the milder symptoms, the sore throat, congestion, that headache, that achiness, fever, there's the opportunity to reach out to your primary care physician. People don't even have to come into the clinic. They can have a telemedicine visit and they can talk through their symptoms. And again, as we said before, if they feel as though that their symptoms warrant them to come into the hospital, then they can direct them there.
Okay, if you've been exposed to someone who definitely is COVID-19 positive, is there anything you can do to reduce the possibility of your symptoms beginning?
Unfortunately, at this point, there is not anything that we know for sure that will decrease the risk of symptoms. But once you've been exposed, it is important to quarantine yourself, avoid especially if you're in the same household with someone else who is immunocompromised, make sure you stay away from them. And there are ways to quarantine yourself safely. At the same time, it's important to take care of your mental health as well. Talk to your providers, seek out what options there are for you as far as outpatient medications are concerned. But as of now, Kyle, specifically to answer your question, there isn't much to prevent COVID after exposure to someone who's been tested positive.
Okay, and one last thing on the vaccine. Obviously, we're encouraging everybody to get vaccinated. Certainly, if you haven't had COVID yet, you need to take that step and get vaccinated. What about people who have had diagnosed COVID-19 cases? A, is it safe for them to get vaccinated? B, how soon after their recovery should they get vaccinated?
I am so glad you asked this question. So even those who have had COVID-19 should get vaccinated, mainly because we don't know how long our natural immunity lasts. after an episode of COVID-19 infection. We don't know how effective it is and how long it lasts. And most data so far shows that this immunity wanes after a 3-month period, so people can get COVID-19 infection again later down the road. So it's important to get vaccinated. Even if you had COVID-19 before, you can hold off on getting vaccinated for about 90 days. This is the time period when you may have natural immunity for the COVID-19 infection itself. But after 90 days period, and if you're being offered the vaccine, I would say get it.
Okay, so 90 days after you've recovered from your symptoms, it's okay to go through the process of vaccination.
That is correct.
Okay, very good. Ladies, we have about a minute. We have exactly 1 minute left in the program. Dr. Atkinson, anything you'd like to add?
Just as we close out every week, just want to remind everyone to make sure that they're heeding the things that we're saying from the CDC across the state. Make sure that we're staying safe, keep the mask on, social distance, wash your hands, and make sure that if you're feeling any signs and symptoms, please reach out to your primary care provider.
All right, Dr. V, 20 seconds.
If you don't have a primary care physician, it's important to take care of your health. It's important to take care of your family members' health, and Mon Health has a lot of excellent primary care physicians. Please visit monhealth.com/primary care. We have our locations listed. You can make an appointment by filling out a form.
All right,
you can also take a look at our Facebook page.
Right, excellent. Dr. Crystal Atkinson, Dr. Archana Vasudevan with infectious disease at Mon Health. Great information again today, ladies, and thanks for your time. We appreciate it.
Thank you so much, and have a great weekend.
All right. That's Mon Health Live, 104.5 FM, 1440 AM, WAJR. All right, guys, we got it.
Thanks so much. Dr. V, you did an excellent job. Dr. V, you did an excellent job. Dr. V.